Hi everyone, welcome to TS Fibro, or welcome back to TS Fibro. It's our fibromyalgia family. Today's video is going to be on depression and fibromyalgia. And if you haven't subscribed to me, please subscribe and hit that notification bell to get notified of new videos I put up. And if you like the video, give me a thumbs up. If you don't, well, give me a thumbs down. Maybe let me know why in the comments below. Depression and fibromyalgia. Fibromyalgia can be a very painful and frustrating illness to have. Fibromyalgia symptoms like chronic headaches, sleep disorders, and muscle aches and pains can make living with the illness difficult and tiresome. Lack of understanding from the medical community can also make many fibromyalgia sufferers feel isolated and alone. As a result, many people with fibromyalgia syndrome experience chronic depression alongside their illness. Depression can leave you feeling alone, anxious, and extremely sad, and can make fibromyalgia even more troublesome to deal with. It is important to recognize the symptoms of depression so that you can seek appropriate treatment from your doctor. You are not alone. Help for depression is out there and can include support groups, prescription medications, and botanical supplements. What is depression? Everyone has felt depressed at some time or another. Leaving a job, ending a relationship, or losing a loved one can all take a toll on your emotions. It is normal and healthy to have periodic feelings of sadness. But depression isn't just about feeling a little blue. It is a chronic, debilitating sadness that can affect all areas of your life. Major depression, the name for the clinical form of depression, can be diagnosed if you feel very depressed for more than 2 weeks. Most major depressions last between 6 and 12 months. Depression is the most common psychological disorder in North America, and it affects about 20% of the population at some point in their lives. Depression tends to hit twice as many women as men, and typically onsets between ages 25 and 45. Fibromyalgia patients are at particular risk of developing depression. In fact, it is thought that at least 30% of fibromyalgia sufferers also have clinical depression, and 50% of those battling fibromyalgia will experience severe depression at some time in their lives. What are the symptoms of depression? Depression tends to manifest itself in all areas of life, including your physical body, your emotions, and your behaviors. Signs of clinical depression tend to be numerous and will persist for weeks. It is important to consult with your doctor if you recognize any of these depression symptoms. Emotional symptoms. Depression's worst symptoms tend to be emotional. If you are clinically depressed, you will experience chronic sadness, feelings of worthlessness, feeling empty inside, lack of enjoyment in activities that once were pleasurable, loss of sex drive or interest in sex, excessive guilt, self-blame. Behavioral symptoms. Depression often causes numerous symptoms that affect how you behave. You may experience trouble concentrating, reluctance to make decisions, refusal to participate in social activities, irritability, being overly active or inactive, periods of self-harm. Physical symptoms. Physical symptoms of depression will manifest themselves in your body or appearance. They include nausea and indigestion, lack of appetite leading to weight loss, overeating leading to weight gain, constipation, difficulty sleeping, insomnia or hyperinsomnia. Causes of depression and fibromyalgia. Most depression is thought to be caused by low levels of certain chemicals in the brain, particularly serotonin. However, depression is so common in patients with fibromyalgia that many people have suggested other causes for depression. No one's really sure what causes depression in patients with fibromyalgia, but there are a number of theories. Reduced neurotransmitters. Low levels of neurotransmitters in the brain, specifically serotonin, cause most depressive episodes. The neurotransmitters send signals to different parts of the brain, manipulating mood, pain sensations, and other functions. Extremely low levels of these neurotransmitters can cause you to feel depressed. Fibromyalgia disability is often associated with low levels of neurotransmitters caused by sleep deprivation and other factors, and depression may be a side effect of these low levels. Chronic pain. Chronic pain associated with fibromyalgia may be a cause of depression. Dealing with frequent and debilitating pain can leave anyone feeling down in the dumps, and this may be a factor in fibromyalgia depression. However, this cause is debated because not everyone with fibromyalgia pain suffers from depression, and often those with the worst pain have a very healthy mental state. Genetic factors. Depression and fibromyalgia may be caused by specific genetic factors. It has been found that a large number of people with both depression and fibromyalgia also have a family history of depression. Therefore, many experts suspect a familiar predisposition of developing depression in these individuals. Effects of major depression on fibromyalgia. Fibromyalgia research shows that depression can have a profound impact on the course of your fibromyalgia. Depression can lead to inactivity and social isolation, resulting in increased risk of chronic pain and disability. Though studies have shown that depression does not increase the severity of fibromyalgia symptoms, depression is more likely to cause behavioral changes that could affect the course of the illness. According to recent studies, non-depressed patients with fibromyalgia tend to be more active. Activity helps to provide relief from fibromyalgia symptoms, reducing pain and fatigue. Activity can also safeguard against future depressive episodes. However, those fibromyalgia sufferers with clinical depression tend to be more inactive, and this can cause increased pain and suffering. Depression tends to inhibit people from taking care of their bodies, which is of ultimate importance when dealing with fibromyalgia. People with both depression and fibromyalgia are more likely to live alone, refuse physical therapy, and even attempt suicide. It is possible to describe your signs of depression as accurately as possible to your doctor, so he or she can try to find a cause for your depression. Additionally, medication can be prescribed to help ease your depression symptoms. Antidepressants, commonly used to treat depression, have also been shown to be helpful in easing some fibromyalgia symptoms. Ways to fight depression. Depression causes you to feel unhappy with everything. It is a devious disorder, and the symptoms often discourage you from doing the very actions that help your recovery. Lack of energy, low self-esteem, and no excitement for life are some signs of increasing depression. Depression is common in chronic diseases like fibromyalgia, and it's highly treatable. Some steps to conquering your fibromyalgia depression include: think about why you are angry. The absence of feeling that deteriorates all joy and keeps you from feeling causes depression. You cut off all emotions and focus on your pain. You are masking your anger and turning your rage inward to yourself. Acknowledge, discuss, and accept why you're angry. Be as active as you can. When you are depressed, your energy level drops, and the last thing you want to do is stay still. Try moving, take a walk, do some light exercise, or work on doing light chores. Moving rises the neuroplasticity of your brain and releases endorphins that help elevate moods. Don't stay isolated. When you are depressed and in pain, it's more comfortable to sit in a dark room and cry. When you feel bad, confide in a friend. It will help lighten your burden. It's okay to talk about our pain and our worries. You are not self-centered. Those who love you will appreciate knowing what's going on in your life. Do something you like, even if you don't feel like it. Don't give in to being lethargic. Stay active and pursue hobbies that light up your spark and keep you moving and doing. Watch a funny movie or TV show. Funny shows might seem simple, but if you can make yourself laugh or smile, you can convince your brain you are happy. Look at depression as your inner voice tricking you into feeling bad. Find your tricks to fight depression. Avoid punishing yourself for feeling down and blue. If you self-hate yourself because of fibromyalgia and depression, you will only increase your symptoms. Your critical thoughts will keep you from trying to help yourself. Be more open, loving, and accepting towards yourself. Make a game of making yourself feel better. A good friend with fibromyalgia makes herself happy by actually talking to herself. It is weird to come upon her answering herself back, but it makes her feel better and happy and dissolves the depression of fibromyalgia. Try therapy. Talking is a powerful way of combating both fibromyalgia and depression. Don't let people tell you you look fine. It's no big deal, or just get over it. There is nothing wrong with recognizing you need help. You can resolve your depression with the help of someone else. Asking for help is smart, brave, and healthy. It doesn't help when you are told that an estimate 10 million people in America have the disorder. You have the condition, and it is hard to work through. Be honest with yourself above all, and you can manage chronic pain. You know your limitations, and listening to your body are parts of pain management. Keep your mindset strong. Don't let depression take over your life. It is up to you to create an environment for taking back your life. Fibromyalgia can cause you to feel hopeless and depressed. You never know what you will be able to do from one day to the next. Understanding what you can and can't do will help you manage your chronic pain. You need to assess yourself when you get up in the morning and be honest. Be okay with yourself and only do what you can do. Well, that's the video, Fibromyalgia and Depression. I hope everyone enjoyed the video. If you did, please give me a thumbs up. And if you didn't, you can give me a thumbs down and maybe explain why in the comments below. I pray for a cure, and I pray you have a pain-free day. God bless everyone.